At Durdledore Beach today, they came in search of sun, sea and some social distancing. But at times, this looked like a holiday from the rules. Officers had tried to close the beach, but from tomorrow, there'll be less policing of this pandemic.
Hi, Dan.
Hey, buddy. How you doing?
For 80 days, this has been Daniel Hanvey's window to the outside world. He's been shielding with cystic fibrosis. But from tomorrow, he can get some real FaceTime and leave the house, if he wants to.
I won't be changing my behaviour anytime soon. I'm genuinely worried that if I were to follow the advice and go out, I'm not guaranteed to catch it, but there would obviously be an increased risk. And I think to lift the shielding measures this early is a dangerous approach, frankly.
Those shielding only in England and Wales can go outside from tomorrow. Everyone else can meet other households in all 4 nations. But with English schools also preparing to take more pupils this week, car showrooms ready to test drive social distancing, and sport also back on track, there is concern the UK government's racing ahead of the science.
I think there is a consensus that we're feeling nervous about this. Until we've got track and trace up and really working well, the numbers are still too high around the country for us to feel secure to be letting people go back to normal activities at this stage.
Today the government did announce it's now got the capacity to screen 200,000 people a day at sites like this one, as those who are most vulnerable test their confidence in the government. Given that the number of cases is still higher now than when we first went into lockdown, why should they feel any safer leaving their homes?
We're not today asking people or advising people to stop shielding. Far from it. What we're saying to the people who have been shielding for the last 10 weeks is that we think that the rate of infection is sufficiently low now to enable you to do some quite modest things.
So I think at the start of this, their expectation if you'd been out would have been about 1 in 40 of meeting somebody with disease. It's now about 1 in 400 to 500.
But today, it wasn't hard to come into contact with a crowd, and with all the relaxing, there's a risk we'll become lazy about lockdown. Paul Brand, ITV News.